Okay, enough with all of that, because we have this fabulous guest that I'm going to fangirl on. Karen Fessel is joining us right now. She's a proud parent of two young adults, and one of them happens to be on the autism spectrum. Karen, get this, founded the Mental Health and Autism Insurance Project nearly 15 years ago. After successfully securing services for her child on the spectrum, she currently serves as the executive director of the organization. It is a nonprofit that helps families secure mental health and autism treatments through insurance by writing appeals. I know, you're getting chills now, aren't you? Fielding questions from the community, putting out a quarterly newsletter, and educating regulators and legislators on insurance needs and consumers. She serves on the Cal-ABA Stakeholders Committee, the Cal-ABA Insurance Ad Hoc Committee, and the Government Affairs Committee of the National Association for Therapeutic Schools and Programs. She's worked on getting both the California Autism Insurance Mandate and updated California Mental Health Parity passed into law and fully implemented. And we've talked about MAPIA from time to time on this show, but you guys know, you that have kiddos that have been shortchanged, that are a little bit older, it's the Holy Grail. Karen has a doctorate in public health from UC Berkeley. I do kind of want to be her when I grow up, but I don't want to have to know what she knows. So Karen, welcome to Autism Live.
Thank you, Shannon. That is an incredible introduction. I'm really, really honored. And I'm your fangirl. So I think you're terrific.
Well,
and I think what you do is amazing.
That's amazing to me, because you have been a guiding light for me, to the point where, you came up to me at the conference the other day, and I was in the middle of I don't know how to be around people. This is not Netflix. And we were standing in line to meet people that I was also fangirling on, and I was shorting out. And so I was afraid that I just because I don't even know what I said to you. But anyway, I was fangirling.
I too am getting my social skills back in order, in terms of how, we've been out of it for 2 years. So it's taking us all a while to get back into the social scene. And it was great. It was a great conference. And I loved the part that you did with the self-advocates and the neurodiversity. That is so important for this community to tune in on.
Thank you. I was bummed out because I only got to go to 2 talks while I was there, because we were doing live feeds. So I didn't get to be there to see what you were presenting. And they're saying that my earbuds are not plugged in all the way. But Karen, because I heard that you were amazing, and I know that you always are. So I felt that. But I just want to say, first of all, did we get the memo? We're wearing the polar opposite of each other. It's
opposite colors. Yes.
Yes. That's kind of cool. I absolutely love that. So I don't even know where to begin, Karen, but tell us a little bit about your story, and how did you find your way to this?
Okay.
Because that's got to be fascinating.
Well, I have a background in public health. And so I'd worked in the healthcare system for a number of years before I even had my child. And I had worked for Kaiser, and I had done some work around guidelines and around new medical technologies. And I understood, I knew about the state parity law. And so I knew that they were required, the insurance was supposed to be covering some of the things that my son needed. And first of all, in terms of what you said about Amy Schumer, it took me till my son was 6 for us to get a diagnosis. And he was at attention at age 3, but the so-called experts took a long time to figure out exactly what was going on. And
but do you agree with what I said, though? She needs to take him in now.
Absolutely. She needs to get him assessed. And I mean, it sounds like she suspects that he might have this, and his father is on the spectrum. So yeah, right there. I mean, it can't hurt to get him assessed. And then if he needs more, intervention, then that's the way to go. Absolutely. Yes. I regret that we didn't get my son in earlier, but we tried. And we did get some services for him. Anyway, when he was about 7 or 8, I was trying to get him speech and occupational therapy and social skills therapy. And I knew about this law, but I was getting like sort of the runaround from my insurance company, and it was really hard to get services for him. And finally, I appealed, and they denied me, and I took the case to the DMHC. And at first, they just sided with the insurance company.
What is the
Oh, the DMHC. Yes, jargon. This field is full of jargon. DMHC is the state regulator in California. If you have a plan, a health plan, if you work for a relatively small employer, or you get your insurance through the marketplace, they are going to regulate your plan. Okay. And so that's a lot of people in California. It's probably half of the population.
And does every state have something like this, something akin to it?
Yes, but not all insurance is regulated that way. If you work for a large company, more than like maybe 200 or 500 employees, there's a good chance you have what's called self-funded insurance. And that means that the employer actually pays out the claims, but they might hire someone like Anthem or Aetna to administer the claims and administer their whole health plan. And if you have that kind of insurance, then your insurance is regulated more or less through the Department of Labor, and they are over your employer, not the insurance plan. And there is actually a bill in Congress right now to change that so that the Department of Labor can directly regulate the insurance company, which is in most cases more appropriate because they know the insurance industry, whereas most employers don't. But anyway, how I got started on this, so I brought my case to the Department of Managed Healthcare, and at first they denied me. And then I called back, and I had like a meltdown on the phone. I just went ballistic on them. And then they were like, okay, well, we'll reconsider your case. And I was like, you're kidding me. And then they reconsidered my case, and I won. Yeah. And then from there on in, I knew, here I am, I have a public health background, I have this experience, and I have to help other people. And it's like, I said that this weekend when I described my colleague Fade El-Malidi, that basically she had to put on her own oxygen mask before she could help everybody else. And it was the same with me. I had to help my own child first, and then I was able to think about other people and how hard it would be. You know, if you didn't have English as your primary language, if you didn't have, knowledge about the laws that I had going into this. So it's been, and now fast forward 15 years, I started my company in 2009, and we just focused on autism then. When we got the mandate passed into law, it was a great thing, but the amount of people that needed my help was much less. And so I switched my focus. I still work with people with autism and ABA, trying to get ABA services. But we spend a lot of time with people with autism and people with other conditions who are trying to get residential treatment, because that can be really hard as well. And a lot of our families with autism, when their kids get to be teenagers, some of them, even though they've had a lot of ABA, they hit the wall and they need a higher level of care because they're falling apart. They have the teenage hormones kicking in. They have a lot going on. And COVID has really exacerbated that thing where a lot of our kids are having comorbid mental health issues in addition to the autism issues. So that's a lot of of how I got into it.
I can only say, I'm so sorry that that's what you went through, but I cannot help but be grateful that, because if you had not gone through that, then so many of us would not have had a place to go for help. And I just want to throw that out into the universe, because I'm sure that a lot of people who are watching today are having challenges in a certain area. But remember that Karen's challenge became her war cry. And she's a rock star helping other families to be able to do that. It can happen, you guys. But I guess I'm sort of sad to hear that families don't need you as much anymore, Karen, because I think they do.
It's not exactly true. They don't need me in the same way. What I can often do, and sometimes they do need me, but what I can often do is advise them. And it doesn't even take a lot of time. Like, I can advise them on what they need to do so that they can help themselves.
Amazing. Because I want you to share because there's so many important things that people need to know right now about insurance. Because I stand by this one thought, which is, insurance is really hard to navigate, but if you can figure that thing out and get that in place, everything will be better. And I stand
once
by
you get the interventions that you need. Yes,
Yeah.
once you get the help that you need.
But you
That's
got to know how to
absolutely
play the
true.
game. There's a
Right.
game, and it's
Right.
hard.
It is a game,
So
and it's not fair. Remember you
not
said everything has to be fair? It
Yeah.
is really not fair.
No.
And it is really, the deck is kind of stacked against you, and it's part of the law that the, sort of the benefit of the doubt, if there's a dispute about what really happened, the benefit of the doubt goes to the insurance company. And that's not fair either, because they're motivated to make money is their priority, and they don't always tell the truth, which is unfortunate. And so it's not fair.
So what do we need to know? Talk to us about right now. What are the most important things that families need to know? And what are some of the laws that we can hang ourselves, hang on to for protection? And if you wouldn't mind, please feel free to talk about it in California, because I think that people do need to hear about it for California, but then also give us a nationwide perspective.
Okay. Well, there is a national law called the Federal Mental Health Parity and Addiction Equity Act. I think you've had Julie Cornack on your show before, and that is, Julie likes to tell everybody that's her favorite law. And MPIA, and so that is a great law. And it's federal, but it applies to nearly all plans, except perhaps grandfathered plans and some government plans. And it works because it basically says that that treatment limitations for mental health can be no more restrictive than they are for medical and surgical health. And so this is relevant in many ways. And including things like age limits. Many state mandates, California doesn't have age limits, but many state mandates do. And MPIA has allowed a lot of those limits, those age limits, to be lifted, like in one fell swoop, like when that became active throughout. And we've, the Autism Speaks has gone state by state and tried to get these mandates lifted, these like age limits, dollar limits, hour limits. So those kind of limitations, because you wouldn't put a limit on how many visits a person with diabetes needs, or how much money even you can spend on it, or how at the age of treatment. No. Also, if they need services during their school day, they're going to get them. So do kids with autism. Sometimes they need ABA to access the curriculum.
There you go. So just to put a fine point on it, because I know some of you are watching and you're like, I don't think this really affects me. But let's say that you have a 10-year-old kiddo right now who's getting ABA services. What I've seen, and I hear from parents all the time, is that then suddenly, your child turns 11 and you're told you don't qualify for ABA anymore. Sorry, oops, you don't get it anymore.
Right. It's more often at age 6 because they start school. And sometimes they don't drop them down to nothing, but they'll try to drop them down to like maybe 10 hours a week. And California, we have a relatively new mental health parity law in California. And it basically says that that the insurance can't say, you need to ask the school district to pay for this. They can't take a public program and it specifically says special education or the IEP. They can't take that and say this needs to be provided that way, so we don't have to provide it. They can't use it as an excuse or a limitation as to why they don't have to provide something. And so that's part of it passed a year ago. And honestly, the regulator is still working on implementation. And so there are still some bumps in the road with that.
But Karen, this is why I'm always great. I include you in my prayers. I'm not kidding, because I love knowing that because the insurance thing makes me totally buggy. Because it's not fair. And I believe that everything needs to be fair, and it's not. And I think to myself, I'm here doing this, but then every once in a while I go, I need to go lay on the steps of the Capitol and say, I'm going to lay here until it's fair. I don't have time for that.
You do have time for that. That is really important. And the more people that we get, when we have something that's really important, yes, we need to show in numbers to our state legislators and our federal legislators that we count, that we're here, that we're watching them, that we need, better regulation. And we do. We still do. Even though we have these laws, the laws are only one part of it. We still need to let the regulators hear from us when we're not being treated right by our insurance company. First, we have to complain to the insurance company, and then we need to go to the regulator. And a lot of families don't know that. They just complain to the insurance company, they get a denial, and they say, oh, I guess I'm done. No, you're not done. You tell the regulator. And if they get enough complaints, they will do something. But they need to hear from you.
Karen taking us to church here. But I want to say to you, Karen.
Sorry to get passionate.
No, I love it. There's a time and a place where you need me and other people to stand on the steps of the Capitol. You tell me, because I will use my megaphone to tell people, and I will show up. If at all humanly possible.
And we may need you sometimes for individual cases. Like, I don't know if you've ever done it, but if a family is willing to talk about their problems getting insurance covered for their child, if they appeared on your show and you interviewed them, and then we sent that to the insurance company, the press, they really respond to the press. They don't like bad press. They want to be everybody's friend, and they don't like it. And so sometimes I would love to partake.
Yes. Absolutely.
Okay.
Absolutely. Use me.
I will.
I'm happy to do it. But I also want to say it's overwhelming to us as parents, and this is why I include in my prayers, because you're working on things. So tell people what your organization does, what kinds of things that you can help with. When should they come to you, and how should they come to you? How do they get in contact?
Okay, so if you're having trouble and you get a denial saying that we don't cover ABA, we want to know that, and we'll take it through the appeal, and we'll talk about MAPIA, and we'll talk about the state. If it's a state regulated plan, it usually isn't. It's usually one of these fuzzy plans that falls between. But sometimes it is a self-funded plan, and we'll take those, and we'll write up an appeal on why it should be covered. And if we don't get them to switch, we will help you find a lawyer. And lawyers have been. There was a case recently in California called Doe versus United Healthcare, and it was huge. And that was done by Psych Appeal and Zuckerman Spader. They do these class actions, and it was successful. And and basically, the judge came out and said, no, you need to provide this service. This is a known benefit to people with autism. You say you cover people with autism, and you're not covering the service. And so the judge called them on it, and now they have to provide the service. So so we will help them find lawyers if they need that kind of thing. So if they get denied right out of the bat, if they're trying to get residential treatment, their child has autism, they're falling apart everywhere, they're violent, they're hitting, it's self-injurious, they're injurious to others, they're suicidal, any of that stuff, we will get involved there. We'll help write an appeal if they've been denied treatment. For autism services, if they get a medical necessity denial, or if they get hours cut and their provider is not able to mount, a lot of times, and this is why there is a little bit less work for me in the autism arena, because the autism providers are so amazing, and they have taken on this fight for insurance themselves. They've made it an issue, and they have they write these amazing appeals, and often they do get overturned. But I'm happy to help. I'm happy to advise providers if they need more detailed information, especially about the law, but I'm also happy to help families. Sometimes we do charge for our services, and we have a sliding scale, but sometimes they are reluctant to spend money, or they don't have the money. We do have a scholarship fund to partially pay for that, and that it's called the Fada and Muhammad Amalidi Fund, and it's in their memory. And it's like their gift lives on through safety. I was part of a panel this past weekend where we talked about fire safety, wandering safety. Kelly Birmingham, who you had on Monday, Kelly developed an amazing safety curriculum. So their message continues to live on. I digress. I am wandering a little bit away from our subject matter.
But but please, that's important information. But I do want people to know how to reach out to you now. Are you just taking families that are in California, or are you taking
No.
right
nationwide.
now. And where do they go to get in contact with you?
Info@mhautism.org. And you can find that through the contact us section of our website, mhautism.org. Okay, mhautism.org. I don't know if you can.
Clayton's going to get that up on the screen.
Okay, great. Yeah.
He's good at it, but let's say it one more time to make sure.
mhautism.org. And we have a lot of tools up there as well that walk you through the process. We have like an outline of what to put in an appeal if you try doing an appeal yourself. So there's a lot of resources there. There's links to other sites. And I have been working on, it's called the Appeals Playbook. It's the brainchild, thank you, of my dear friend Amy Pearl, and several of us have been meeting every week for over a year, and we had a couple of lawyers, we had a regulator, we had several advocates, we had some ABA providers, and we talked about everything that needs to go into the appeals playbook. So if you get denied treatment, you may need to look in the detailed index to see where you need to look for the information that you need. And there are sample letters in there and things like that. So medical necessity denials, we often get called in to help with those. And sometimes it's a dispute about hours. They might cut someone back from 30 hours to 10 hours, and it's going to make a huge difference in their lives. And so we will write detailed appeals on why that service needs to be provided. We also use the CASP guidelines, and part of the new California mental health parity law is that the health plans are required to use guidelines that have been developed by professional bodies, professional experts in the field. And so the CASP/BACB/APBA, those are a lot of acronyms. Those are the professional organizations in the area of ABA. And so they have developed guidelines, and they are not supposed to be using their own guidelines anymore for California regulated plans because of this famous court case called Witt versus United Healthcare. Have you done it? Are you familiar with that court case?
I am not.
Okay, those are good people for you to have on. I would say Mayron Bendat or Caroline Reynolds, and to talk about
Caroline Reynolds on before, but it's been
okay. So that's her case.
Years. Okay.
Oh, okay. So maybe that case, we got the amazing verdict. I think it was late 2009. It was sometime March of 2019. So I'm not sure when you interviewed her, but getting her perspective on that case, be amazing. It's actually still, she appealed it, and we're waiting to hear back on the appeal.
Wow.
But it was a big victory. And so this law formed because of that. Amazing. And the Kennedy Forum is bringing that law to other states as well. Like they're introducing that mental health parity mandate in other states, just like Autism Speaks took the show on the road and brought it to they brought autism mandates to many states. Kennedy Forum is doing that for mental health.
Do you guys see what I mean about how amazing it is when you realize, oh, while I was sleeping, these people were working on this? Because none of us get there by ourselves, right? Absolutely amazing. Okay.
Thank you.
Now, one of the things that families say, though, and you brought it up, that there's a cost for things. And
yes.
Sometimes families can't afford it, and you have an amazing scholarship. I'm so proud of you guys.
We have a scholarship, but they do have to partially pay. So it would reduce the cost significantly. And we do that if we'd done it for free. It's really hard to get grants to do this kind of work. And so we wouldn't be here still if we didn't have a cost. And I feel bad about it, but I also feel like it's needed, because we wouldn't still be here.
But people need to understand that, it's always like this, right? That your child, maybe in the first year of therapy, let's say that you have a 3-year-old and they're going to get intensive, early, really good quality behavioral intervention, that, depending on which state you're in, that could easily cost more than $100,000 if you were going to pay for that out of pocket.
Oh, absolutely.
But then if you do it through insurance, maybe it's going to cost you
your deductible.
Yeah, maybe
Yeah.
it's going to cost you $3,000 for your out-of-pocket maximum, and you're still thinking, well, I can't even afford $3,000. And I
No,
might
it's
have to
worth
go to
it to
Karen. Right.
invest in it. Yeah.
If
It's
I
an
said to you,
investment.
right, if I said to you, here's this bottle of water that you desperately need, and it's a $10,000 bottle of water, but I'll sell it to you right now for $2. You would look at it in a different way, because you would start to say, okay, how can I fund this? So I know part of what you do is actually save people money so that they don't
Right.
have to go
Right.
broke. Talk about
Right.
the difference when people understand how to use insurance. How are you helping people to not go broke? Talk to us a little bit about that.
Well, if insurance pays for it, you don't have to. I mean, that's very basic. I mean, one of the things that I think it's important to know, when you can use in-network providers, it will save you not only a lot of, it will save you a ton of aggravation, and also it will save you a ton of money. And the other thing is, it puts the onus on the provider, not on the consumer. When you're using someone in network, they have to follow all the rules, and you are a beneficiary of their hard work. And so I do advise people, when possible, to use in-network providers. And when you don't, get in on it early before you go out of network. Make sure that you get permission from your provider to use your in-network, your in-network benefits out of network. And they
Yes.
can do that if the network isn't adequate. And we see that a lot with autism, and we see it with mental health now as well. And it is because there is such a greater need for these services than there are people, that there are way more people that need these services than there are, providers that deliver them. And one would think, in most regular market scenarios, the insurance industry would be kind of making it easy for these providers, but they're not. And I think that says something about regulation, and that we need more regulation, because if they were getting in trouble for not finding providers for their clients that need them, then they would be more. They would make it easier for everyone working with insurance to get coverage, and they wouldn't be putting up obstacles and taking their time in paying claims and doing all the things that I happen to see the underbelly of insurance, the underside, and it does sometimes work very well for families and for providers. But I see a lot of the problems. People call me when there are problems.
Yeah, you
So
got to know how to work it.
yes,
Because I don't know, because all of us didn't come from a background of public health and insurance.
right.
And so I just want to, so did you guys understand what she was just saying? That maybe it's better to be in network, but let's say that you're in a place, only provider that,
Let's say there's no providers in your network.
or there's one that's there that says they have a 2-year waiting list. And a lot of our families go, well, I'm on the 2-year waiting list.
No,
I can do.
don't.
There is stuff that they can do, correct?
Yeah, you can get on that list, but also call down the list. Get the list, call down the list. I would say you don't have to call every single provider on the list. I'd say call maybe 15 or 20. Mark up your list. If they don't call you back, that's a no. Anything but a yes is a no. And so and it is a problem with ABA right now, for sure. They're just, and speech and OT and residential treatment. A lot of the places in the plans networks are full. If that happens to you, go to parent resources, go to parent support groups, and get names of other providers perhaps that aren't in the network. And then you go back to your health plan and you say, I called 25 people on this list. No one has availability, or nobody can do feeding therapy, or nobody can do adults, or nobody can do the specific thing that my kid needs, which is sometimes ABA. There are subspecialties. And so if nobody can deliver that service, and someone out of the network that can, you go back and you tell your care manager or the care management department at the insurance mental health side of things that nobody can do it. Do they know of anyone who can do it? They might give you a couple more names of places to call them. If they can meet the need, fine. If they can't meet the need, you go back and you say, no, you're not finding anybody. And if they don't deliver, the law, we're working on regulations around the parity mandate in California. And some of the regulations say, give them like 5 days a week. If they can't deliver, write it up and send it both to the insurance company as a formal grievance, and send a copy to the Department of Managed Healthcare and fill out their form. And they are supposed to, because with this new parity law in California, the onus is on the health plan to find the providers. And so if they can't, then they need to let you go out of network and at their expense as a single case agreement. And then you have continuity of care. You're allowed, once they agree to it, there's a certain amount of time that they need to continue to cover it, and they can't just pull you off because they found someone for you.
There's just all these things that I think the basic parent doesn't know, and this is why Karen is there. This is why she's created her company. This is why I would encourage all of you to go to mhautism.org. Talk to Karen, because this is overwhelming stuff. We thought that the school stuff with the
school stuff is overwhelming too,
and we thought that was like, oh my gosh. But then when insurance came along, and it's just like that much more jargon, that many things.
Right.
For a lot of people, it's just too much.
And then there's the regional center tue. And the regional center is the payer of last resort. But remember that, because if you can't get services from your school district or your insurance company, and your child is a regional center client, you go there, and they are supposed to provide as well if it's needed. Somebody's asking how my son is doing. He's doing really well, and I get to Fessel, and he is working as he went and got his AA in early childhood ed, and he's working as an aide in a preschool, and he loves it. He loves working with the kids. He loves seeing their challenges. He loves seeing their accomplishments, and he sometimes says, I think that kid might be on the spectrum, Mom. And they do like it's a great preschool, and they do regular trainings, and he loves the trainings too. So he learns new information, and he's doing really great. And he's living in a setting where they're kind of keeping an eye on him. He doesn't get a ton of stuff, but they check in with him, and they make sure that things are moving. So I'm very proud of him. He's come a long way. Thank you for asking, Sarah. Thank you.
And we're almost out of time here, but I just want to say, to me, the whole insurance thing is so aversive. Although there's a good benefit at the end. So you've chosen to devote your life to this. Talk to us about what the hardest parts are and what the most rewarding parts of working in this field are.
The hardest parts are sometimes when the regulator doesn't follow the law, and it does happen, and it's really, really, really frustrating. Or they interpret the law differently from how I interpret it, and that does happen. So we'll hit like sort of a wall. And that's really, really, really frustrating. That's the hardest part, I'd say. The most rewarding part is winning, number one. But it's not just winning. Sometimes it's just to be able to tell a parent what they need to do to get services. And sometimes their questions, I can just help them in like 5 minutes. And that's really, really rewarding too. Like I can give them some advice that they had, like calling down the list and getting back to the person, following up. Be a terrier. I have a poodle now. I used to have terriers, and they just hold on to things. So hold on and see it through. Stay the course. And it's not easy, but stay the course. And they want you, insurance wants you to give up and drop out and give in. Don't give in.
I think Nancy Allspot Jackson, and she always says, be a dog on a pork chop. That's what I always think.
Yep. Put your teeth around it, don't let go, and stay the course. And eventually things will start to pay off. And if you have to invest in a psych evaluation, say, to get an expert to say something that, say, you're maybe Kaiser. I say this because it's all connected, an integrated system. So sometimes you don't get the diagnosis you may need. It's worth the money to invest in an independent person to say what's needed. And sometimes insurance companies may muzzle their providers, sadly. Yes, it's true. So,
Karen, I don't know if you realize how much of an answer to a prayer you are for me and for so many other people. I just so appreciate you. You just have no
well,
idea.
I'm honored, and I'm impressed with your son. It sounds like he's doing amazingly.
He's doing great.
And that he really benefited from all these services. And
he
so
absolutely did, which is why I have a responsibility to make sure that other people,
that's exactly how I feel.
And I think about that every day.
Right.
Will you do me a favor and promise me that you will call on me whenever I can be helpful?
I'd like you to interview some of the parents that have had a real challenge in getting services. I think it would be great to shine a light on what's going on and when they can't get the services they need. So I love that idea.
Be happier. Let's make
okay.
Right. I have to let you go because it's
okay. That's fine. We're at time.
You're amazing. Make sure that you guys go to mhautism.org and take advantage of what Karen has built, because I know for those of you who have been like, where's the person who's going to help me with this? Now you've met her. I'm excited to have brought her here.
Thank you so much.
Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. To subscribe, click here. And if you'd like to check out some more of our videos, click here.